applied in developing training programs for children undergoing hemodialysis, and in fact improves their quality of life when self-care abilities are regained. Dorothea Orem's self-care nursing theory has great testability. Testability can be measured in both inpatient and outpatient settings. For outpatients, patients who received self-care education at discharge and throughout their inpatient stay can be compared with patients that did not receive self-care education. When educating patients on self-care techniques, it is important to assess the patient's abilities. Then meet the patient where they are at in terms of abilities, both physically and cognitively. Dorothea Orem's self-care nursing theory applied to research can be examined in the study The Effect of Self-Care Education based on Orem's nursing theory on quality of life and self-efficacy in patients with hypertension, a quasi-experimental study. This study focused on whether patients' quality of life improved with self-care education and support. The study had a control group and an experiment group. The experiment group had self-care interventions weekly and post-discharge, while the control group did not have any interventions. Immediately after the study, both groups were similar with their quality of life scores. 8 weeks after the study, the experimental group that received self-care education reported a higher quality of life. The study showed that educating patients about self-care and ensuring the patients felt supported positively impacted the outcomes of the patients that received services versus the patients that received no services. For Orem's self-care theory, the parsimony is a basic assessment to find out what a patient's abilities are for caring for themselves. Establishing self-care deficits with patients is the basic part of Orem's theory. Overall, Orem's theory is complex in nature. Self-care can be broken down into 3 nursing systems: wholly compensated, partially compensatory, and supportive education systems. Assessing and understanding a patient's needs to understand which nursing system applies can be complex. It is important to evaluate whether the patient goals around self-care are able to be shifted with time or if the goals remain similar. There is always added value in extending nursing science. Nurses spend the most time directly giving care to patients. This allows for a unique look into what areas of care need more attention. One mid-range theory that directly relates to Orem's self-care nursing theory is self-efficacy. Self-efficacy is an individual's confidence in controlling one's own behavior. Self-efficacy was first spoken about by Canadian psychologist Albert Bandura in 1977. Bandura simply put the concept of self-efficacy as a person's belief in their ability to succeed. If a person has high self-efficacy, they are more likely to be able to handle obstacles that may arise in day-to-day life. Self-efficacy is related to Orem's self-care with the basic ideas of completing ADLs without assistance, managing psychological needs, treatment for conditions, and social interactions. Patients with high self-efficacy will be able to carry on with their self-care more easily. Nurses need to be evaluating patients' self-efficacy to better address patients' needs. It is important that nurses are examining potential patient obstacles or evaluating if patients need to reframe thoughts in order to have a more positive outlook. Having a grasp on self-efficacy of patients helps better support patients with self-care.